episode of the NLN Nursing Edge podcast. I am Raquel Bertiz, your host for today, and I am joined by Dr. Kelly Bryant. She is the director of the Center for Innovation in Education Excellence, and I am the senior manager. So today we have our guest, Dr. Jaslyn Moreno. And before I give you her brief background, I would like to say that she is a very good friend of the National League for Nursing. So, welcome. And she is the project director of the Maryland Clinical Simulation Resource Consortium, otherwise known as MCSRC. The goal of MCSRC, which is a consortium of pre-licensure nursing programs in Maryland, is to increase the quality and quantity of simulations in pre-licensure nursing education. Today, we have a very interesting topic. So, welcome, Jaslyn. Thank you for joining us.
Thank you so much, Raquel, for that warm welcome. And good to see you again, Dr. Bryant Kelly. Wonderful to be here back at NLN.
We're glad to have you back.
Yeah, so let's talk about this very novel and innovative idea here. And for our listeners who have not heard about OSTEs before, what is OSTE? What can you tell us about OSTE?
So I know the term OSTEs is not in everyone's vocabulary. So it stands for Objective Structured Teaching Encounters. And it's really modeled after OSCEs, Objective Structured Clinical Examinations, which many of us are familiar with. But here, rather than assessing the learner's clinical skills, OSTEs really focus on educator competencies. So we have educators who have an opportunity to engage in realistic teaching encounters with standardized learners. So instead of standardized participants, we have standardized learners, and they receive structured feedback. So really, OSTEs provide a safe environment to practice, reflect, and grow as an educator. So that's kind of what OSTEs is in a nutshell.
I remember the first time I heard the term OSTEs, I thought somebody was saying OSCEs incorrectly, and I was like about to correct them. Then I realized it's a totally different word.
I've been corrected many times.
So can you tell us a little bit, like what are some of the common challenges that you see that simulation educators face when that OSCEs can help address? What are those gaps that you find the OSCEs do a great job of kind of closing for our simulation?
Let me start by sharing my background and why I really grew towards this direction of OSCEs. I've been in the space of faculty development for quite some time, and I do acknowledge that we have many opportunities for sim educator training, formal pathways. MCSRC has one, NLN has one, and Axel has one. And after doing that for quite some time and really working with our educators through those programs, I realized there was a gap. And the gap is really evaluation and feedback, which are essential for individual growth. And so I started looking and really doing some research into OSTEs and found this to be an amazing opportunity for our educators. So going back to your question about what are some common challenges or novice simulationists might be facing. So one of the biggest challenges I see that our educators have as they transition into a sim educator role is really transitioning from the clinical expert, from someone who has the knowledge and who's in the front of the classroom lecturing, to someone who's working side by side and really becoming a facilitator of the learning experience. So that, I think, is a common challenge. I know I can relate to that in my personal experience and my growth throughout my career. And I see that very common, where it's just, how do you create that safe environment where your learners can engage at a higher level and really challenge their thinking, instead of just imparting the knowledge that we consistently do in a traditional model.
You're right. And in many instances, really, many of us go right into nursing education without that formal preparation.
Yeah.
So now that we have, many forms of formal preparation, like what you said, we have some courses here at the NLN, and then you do that simulation education leadership training at MCSRC. However, I think the challenge remains in terms of why, even if we've had all these educational opportunities, we still have a lot of inconsistencies in what we would ideally expect our facilitators to do. Like I've seen this, like debriefing. People do all types of debriefing, right? And how do you think OSTIS would be, I would say, useful to
Yeah.
kind of like navigate through this challenge?
Yeah. So I know Raquel, you and I have talked about this for quite some time, and I'm sure Kelly has pondered on this as well. From my experience at MCSRC, is I followed a cohort of educators who came through our Cell 1 training, our foundational course. And I did a small qualitative study to see, where they were a year out. How are they applying their knowledge? And what I found was very interesting. There was a large cohort of educators who did not have an opportunity to really apply the knowledge that they had gained. So then what do we see? We see skill attrition, right? And then they sometimes revert back to what they had been doing prior to the training. So I think that speaks to some of the inconsistencies in the debriefing practice, the pre-briefing practice, even after the training. So not having opportunity to practice the skill that they've gained this knowledge through the training from, and then really not having any feedback on where their strengths are, where they need to really improve upon, and how to move forward. So I think OSTEs is both a way to be able to practice the skills and then also an opportunity to receive feedback. And these are the two components that I think we're missing. Like we've done some amazing work in the field of simulation in growing our pedagogy and really growing educators across the country. I think just over the past 10 years, it has really been a wealth of knowledge. But one piece that I think that we're really ready to emerge or really approach is evaluation and feedback. And I think that's the missing loop. I think that will help develop these competencies. And I know nursing education is competency-based education, right? So I think it's very timely for educators to really experience that. And that's another advantage to going through an OSTE is not only do you get to practice, you get feedback and you get to experience what structured feedback in a positive environment looks like. And that's a bit of role modeling that's done intentionally.
So, Jaslyn, I think this model of OSTEs is very important. It's needed. In a simulation field, we spend so much time on doing simulation training for our educators, but not enough on evaluating simulation educators. So my question to you is, if you're at an institution where you haven't, started using this kind of format or even evaluating your sim educators, how do you create that kind of change in the culture and that safe environment so that sim educators feel comfortable and actually, maybe one day look forward to being evaluated? Because, initially when anybody hears that somebody's coming to watch them or evaluate them, you're a little anxious and, maybe for some people it may be uncomfortable. So how do you kind of create that safe space and create an environment where people, will look forward to going through these OSTEs and looking at the positive side of it, as far as
Yeah.
getting feedback and helping them to improve their simulation skills?
I think that's such an important component, and I can speak from personal experience that that has been one of the barriers. When we piloted the OSTEs through MCSRC, when the day came, I got emails of people, "Oh, I'm not feeling good, I can't come."
I can imagine.
And I got the message loud and clear.
Mhm.
In medicine, when I studied the process of OSTEs, they didn't really have psychological safety embedded. And when we really were thinking about translating this into the nursing profession, that was one of the biggest pieces that we added in. We said everything that we do in the OSTE process has to be surrounded by psychological safety. So that is a concept that's threaded throughout the process. And I think what you're referring to is a cultural shift. Educators do not like to be watched. We are excellent at giving feedback and evaluating our learners, but when it comes to having that experience on our own, it's nerve-wracking, right?
Mhm.
And it's very humbling. So I think it really requires us as a profession to be open to this experience. So we've done a few pilot experiences with our educators, and what we really highlight is that this is not tied to your job promotion. This is not, this is really an opportunity for you to improve your skills. There's no one saying that you're not going to facilitate sims if you don't get a certain score. It's really for personal growth, and that's how I've championed it. We do ask for volunteers. We're not making a requirement for anyone to complete it at this time, but we're hoping that having a few folks participate, the message gets out that this is a positive experience. They're really able to grow. And one of the biggest pieces is we're just prompting them to reflect on their practice. I know we've heard about the Dunning-Kruger effect, and we do, we've done self-reflection or self-evaluation for quite some time, but we know it's not always valid, right? So to hear from an expert and really helping you prompt your thought process on, what are the challenges you're facing, what steps you need to take in order to advance yourself in this area, has been very eye-opening. And that has been one of the biggest takeaways that our participants have been sharing, is that they enjoy being able to self-reflect. And they never saw it from that perspective until we brought it to their light.
Mm. Yeah, so these are very interesting concepts, if you will, to kind of like, okay, um, how do we do this, right? So like walk us through
Yeah.
the typical OSTI process.
So I have to say, it's been a humbling experience because there are so many components, and I'm looking at opportunities to simplify. But pretty much what you have is you have faculty who are educators that participate as your participant, right? So they're coming into the experience. And then you have standardized learners. So these can be your standardized patients that are actors that will be scripted to play the role of a learner. So for our experience, we have a actor who plays the role of a learner who's very talkative and very confident, but has knowledge deficit. We have someone else who is inquisitive but very shy. We have a third person who's not engaged at all, right? So these are roles that we've created, and our actors play these roles. And then you need evaluators. So you need people who are experts in pre-briefing, debriefing, the pedagogy of simulation, who has a wealth of knowledge and who's willing to serve in this role. And I will tell you that you need to have more than one evaluator in that space. I've been doing it for some time, and I had built into evaluators. And every time I go through an experience, it's so nice to have someone there to be like, we're on the right page, right? You're thinking the same thing I'm thinking. Where are we? Is there any bias that's coming through? And having that peer check has been very valuable. So two evaluators, if you can facilitate that. And then you want to make sure that you have a standardized scenario. So a scenario that's well designed, that really looks at any bias that could be present, and I use a scenario that any educator can facilitate. It's not about content expertise. It's really just about facilitating a session with your learners. And then you need a tool to evaluate your learners. So using a standardized evaluation tool, we got permission from Dr. Layton to use the FCR, and that's been going very well, Faculty Competency Rubric. And that has been working well for us. So those are the different components of an OSTI. I have facilitated this in a virtual environment using Zoom. So our educators will come there. We have a video that we use as the sim experience. So our educator will pre-brief the learners in the Zoom platform. Then they'll watch the video. Then they'll go straight into a debrief in Zoom. And following that debrief, we ask our educator and our standardized participants to go to another room, and I confer with my peer evaluator, and then we bring our educator back, we bring our learners back, and we give feedback. And then we have opportunity to collaborate, hear from them, and it has been very rewarding. Everyone who has participated has had positive experiences and are really, looking forward to how they can improve their pre-briefing and debriefing skills. I know, it's a lot.
No, thank you for those steps.
Okay, so I think I'm going to ask the last question, and this is about the future of nursing education in OSTIS. So where do you see OSTIS in the future?
Yeah, so I think, OSTIs are being increasingly discussed beyond sim centers. I think we can see OSTIs having a huge impact on nursing education and really impacting healthcare practice. I can see this being a valuable experience for preceptors, nurse residency programs, clinical coaches, and even leadership development. We in SIM, we provide experiences for our learners to practice before they're at the bedside, right? What if we had those opportunities for roles like educators, leaders? I feel like I prep all the time when I'm teaching. I go through my lecture and I do it on my own. But what an amazing experience to get feedback from an expert. Because I always ask, we ask our peers, hey, what do you think? Should I do it this way? Should I do it that way? But to have that formalized pathway, it can really reshape, I think, healthcare overall. OSTEs really have a tremendous potential as a workforce development strategy because they provide structured opportunities to develop communication, feedback, coaching, and facilitation skills that are essential across healthcare education practice settings. So I really think it's limitless. I think we're on the brink of something, and in my experience, it always starts with SIM, and then it
Mhm.
becomes a wildfire, and we reach out, right? So I believe OSTEs can become an important component of competency-based educator development. I think that's one of the biggest pieces that I'm looking at now because all of our schools are looking at competency-based education. And I think this is a relevant topic for them as educators because it creates intentional pathways for preparing, assessing, and supporting educators throughout their career.
That's an amazing wrap up to the future of OSTEs, and I do believe that as well. We are the pioneers of innovation in nursing education, and I am saying that because I see the two of you are, and we belong to the simulation world, right? So, and I do kind of like, yes, that's who we are. So thank you for joining us here, Jaslyn, and yeah,
And
any
Raquel, can I
final
just do a
word?
last minute plug? If
Okay.
anyone's interested at their institutions in starting OSTEs and looking at research and maybe not finding the right tools, feel free to reach out to me. I'm in the process of publishing and really getting some tools out there in collaboration with the NLN. But in the meantime, feel free to email me, and I would love to help work with your programs.
We'll make sure we add your email and your contact information at the end of this podcast. Thank you for sharing and being willing to work with others on getting their OSTEs started.
So thank you for joining us for this episode of Nursing Edge Unscripted, brought to you by the National League for Nursing. Thank you to Dr. Jaslyn Moreno for sharing your insights with us today. So we appreciate your support, and we look forward to continuing the uh, conversations of issues in nursing education in our next episode. Thank you.
Thank you for having me.
Thank you.